This is Fox 26 Morning News at 8 a.m.
Also coming up this hour, a chiropractor is going to put our posture to the test. Slouching doesn't just cause back pain, it can affect your overall health.
We'll be sitting like this the rest of the day, won't we? It's always good to have a reminder, right? You can kind of get a little comfortable, a little too comfortable sometimes.
Yes, you can. In Health Watch, is it possible to improve your overall health and happiness just by correcting your posture?
Great, now I'm trying to stand up straight. Dr. Verheul with Houston Spine and Rehabilitation Center says absolutely he's here to put our postures to the test. Good morning to you, doctor.
Good morning, good morning.
Thanks for coming in.
Thank you, thank you.
So let's talk about bad posture, because obviously it can lead to other health issues, right? I mean, I notice if I have bad posture, my back hurts, my arms hurt, even my legs hurt sometimes.
Yeah, typically, the main thing with poor postures, patients usually come in and they're having just pain, headaches, stuff like that.
Okay. What would you say could be the health benefits of having correct posture?
I mean, a lot of it, I know, I guess you're feeling more confident. Lack of pain is probably the main motivation for people to want to have correct posture, because the longer you go with poor posture, the worse it's only going to get. And that's typically what we see, patients coming in that have been sitting at a desk for years are now complaining of severe headaches, muscle cramps, stuff like that.
Yeah, just not feeling well. All right, well, I'm going to take a seat then, I guess, Jose. I'll go ahead and take a seat.
Sure. Ladies first.
That's right.
I would usually sit just like this.
Well, that's it. So here's the main thing. A lot of time patients come in with low back pain and hip pain, and I'm like, well, it's usually due to having a leg crossed over the other one.
Oh, so I should be sitting like this?
That's it, yeah. Usually like that, and you typically want to have your back up against the back of the chair, because what can happen when you're perched forward, kind of like an owl is what I call it, is that you can start to slouch forward and allow that low back to settle in.
Oh,
so you want your back like that, up against the chair, sitting tall, and then feet flat on the floor, not crossed.
Is it normal that I feel my core is working right now?
Absolutely. That's typically what you want, trying to engage that core.
Recently there's been talk about not just sitting, but standing at workplaces. And those who don't stand, and there are a lot of them in our area who don't have to stand while you're working.
Yes.
What is the best way to sit while you're working at your desk? Because you're not just sitting still, you're constantly doing things.
Yeah. Well, I mean, it just depends on, the good thing is just to not be sitting for more than 30 minutes. Typically, I just tell patients, you gotta be getting up every 30 minutes. Get up, walk to the washroom, go get some water, anything that just gets you up out of that stuck, static position. And typically, if you have a computer, you want the monitor at about eye level, because if anything lower, you're going to start to do this, and then this, and then you just...
That causes other problems with the back.
Yes.
And I was going to say that already leads me to my next question, which is, nowadays everybody's attached to their cell phone. I mean, I'm constantly like this, looking down at it. So what are some of the tips? Should I just hold my phone up?
Well, that's the thing. I tell patients, I said, really, you're not going to be able to avoid it with your phone, just because nowadays our whole world is like this, you know what I mean? So the phone is just a tough thing that, I mean, trying to, the earpiece can typically help when you're trying to talk on the phone instead of doing this sort of stuff, but other than that, you're just having that head in that forward posture is just taking your center of gravity and moving it forward and just putting too much strain on.
What about some tips for the folks at home now?
Typically, I would just say with computer work is try to sit tall, try to sit with your back against the chair, having a good lumbar support, and then just taking breaks every 30 minutes. If you're standing, typically you want to be trying to stand tall. I tell patients try to stand tall as opposed to getting those shoulders back like that military look. You want to just try to be standing tall, engaging the core, not slouching, and not having your knees locked.
So now you're saying I've got to get rid of my ottoman.
There you go, yes.
All right, thanks so much.
That's the thing, we don't have to go work out, because I got my workout in right here, sitting down.
There you go.
Thanks a lot. Great information.
Yeah, thank you very much.